صباح الخير طلاب دراسات كلية الصيدلة جامعة بغداد. Today we'll talk about systematic review. Nobody heard about it, only few. I think it's worth to be mentioned here. And you need to know about the systematic review because you will need it for sure in the future. It's a literature review in systematic way. It's not scopic review, it's not narrative review. You have to have systematic. You need to work in system so someone can check after you. Systematic review, it's really systematic way of synthesis data. That means we need to follow certain rules and the steps before we can find the results. So everything should be documented and written from the first step until the end. That's why it's called systematic. It's not just you collect 5 studies and you summarize them, you put them in the paper, you say, I have this review. Those kind of reviews, with the time, systematic review becomes one of the top quality evidence-based. That means researchers, healthcare providers rely on the robust systematic review. The more advanced step is meta-analysis. Sometimes we do systematic review only. Sometimes we do systematic review plus meta-analysis. Meta-analysis is one step ahead when we need to collect data, pool the data, and analyze the data of the included studies. So you don't have to do meta-analysis, but at least as graduate students, PhD students, I encourage you to understand, and you do in your PhD thesis, you have time. If you can do systematic review in your PhD thesis, it really helps you as it's helped me in my PhD thesis. So in general, systematic review, then the next step is meta-analysis. So usually meta-analysis comes after the systematic review. When we do a systematic review, the last step of the systematic review is the meta-analysis. So you don't have to do meta-analysis, but it's encouraged to do meta-analysis. We'll talk about this in the next couple of slides. As you can see here, systematic review is in the top of the quality of the research. It's in the top. Why it's in the top in the evidence-based? Because the researchers, they don't have time to go over individual studies. We have no time to go over individual studies. If you need to read 30 studies about certain topic, this systematic review can summarize 30 or more studies for this topic for you. So it will save you time, save you conclusions. If it's robust, you can rely on it. So it's on the top of the evidence-based data or research. Imagine why they put it in the top. Because it summarizes the research in this topic. That's why I encourage you to conduct systematic review and to read systematic review on your topic. If you don't have time to go over individual studies, just search for systematic review. Will save you good amount of time. Why we need to go systematic review? For any new topic, we have no idea about it. As I said, it's better to do systematic review. So it's for any topic, you don't have an idea about it. You need to see, for example, I conducted a systematic review about flu vaccine in the Middle East. Flu vaccine. So before that, why I did the flu vaccine? Because we have scattered studies about flu vaccine in the Middle East. I collected all these studies in one systematic review. So the reader, the audience, when come to my review, they will understand the flu vaccine behaviors or trend in the Middle East over the last 5 or 6 years. So it's kind of summarizing. It will answer your questions. It will give, it's also to find out if you have gap in the literature. For example, when I conducted the literature review for my PhD thesis, I was looking for factors influencing medication safety in nursing homes using SEEP's model, quantitatively. So I was wondering, is there anybody else did something what I did? So I tried to find out all the related studies. I collected 60 studies. I put them in my review to review all the studies related to medication safety in nursing homes, compile all the results and finding of these studies in one article. So anyone interested in medication safety in nursing home can read my systematic review and will find answer to their questions. Which factors, if they are looking for organization factor, individual factors, environment factor, collaboration factor, tool factors, all these factors, the readers or the audience can find their answer. So it's really important. Nowadays, nobody can publish systematic review without following PRISMA. PRISMA guideline, it's essential. It's similar to we have STROBE list. Do you remember STROBE for observational study? And CONSORT for clinical trials. We have to have checklist. Before you conduct a systematic review, you need to follow the guideline. Every one of these checklists must be available and you must follow them so you can publish your study in a high quality journal. All the high quality journals now required you follow one of those guidelines, and most famous one is PRISMA. So you need to conduct flowchart. Flowcharts started from which which search engine you used, and if you excluded studies, why did you exclude them? You need to justify. Those studies excluded because they are not in English. Those because they don't have primary data. Those because they are out of scope. Everything you need to exclude, you need to justify and put numbers. You cannot just exclude and go on. It's systematic way. Should be repeated. At the end, we started with 3,000 or 3,000, we ended up with 69. This is my flu vaccine flowchart review. I ended up with 69 studies. PRISMA is checklist. You have to meet all the requirements and goes on in the list. This is just the half of the list. You need to include identify the abstract. You need to justify the rationale, research questions. You need to put inclusion, exclusion criteria. You need to put which search engine, keywords, all the requirements, all the process. You need to include them. For example, I gave you from my literature review, I put the page number. So the journal required this checklist. You need to put the page number. For example, it's not enough to say I follow the checklist. You need to show the journal which page you mentioned this item, which page you mentioned this item. We ended up with specific page number, as you can see here. I put the numbers of pages. I put those information in. So my PhD thesis is a good example. I need to encourage you. You can do it because I did it. You can do it. It's not impossible. If you have time, this is my supervisor, Dr. Bill Doucet. This is my literature review in JAMDA. It's published before I defend my thesis. So you can do it, literature review, even before you start your work. It's important and it's really well cited. People will cite your work. Now I have more than 55 citations for my system. It's more than my PhD thesis paper. My PhD thesis paper citation less than 10. While the literature review is 55. That means it's highly citable. People looking for information in systematic review. So I think it's worth to be mentioned with your advisor if you can do it. This is my first systematic review. I have done 3 systematic reviews so far. This is my first one. It's PhD thesis about the comprehensive. I didn't call it systematic, but it's systematic. It's comprehensive literature review about factor influencing medication safety in nursing homes using system models. You can use model, you can use guideline, but you need to justify it, and this is cited 53 times. And with the time, increased citation to 55 from Google Scholar, so it's well cited. The second literature review, I want to give you example to encourage you to do it. It's time consuming, yes, but it's worth it. It's time consuming, but it's worth it, and it's really highly citable. The second one we have conducted with the team from Zahra Adil from the US and Dr. Fadi Yaqub from our department about comprehensive review of drivers influencing flu vaccine acceptance in the Middle East over the 6 years. Look to my limitation. Only the Middle East, only over the last 6 years. So you don't have to go all the flu vaccine since 19th century. Just pick up the last 5 or 6 years, because you want the most updated ones. Because if you go before that, you will find another one. You will find another systematic review. So one of the justification to conduct systematic review is the previous one, like for example, in the last 5 years. So you have good reason to conduct a new one. But if somebody else conducted one last year, you need to change the topic. So I conducted over the 6 years only in the Middle East. I didn't go in the US, I didn't go in the Europe. So I was focused on the Middle East. So you can be focused. You don't have to be broad. Because if you go broad, you will find thousands of results. So you cannot handle large number. We handled 60, 69. But this is, I just want to give you example about non-systematic review. We published one recently this month with Dr. Ali Hamza from Toledo. This is scoping review. Scoping review is not systematic review. We collected 8 studies from the literature. We summarized them. We put them in article. We publish it in Rafidain one. So this one, we cannot compare the scoping review with systematic review. This one will have lower expectation. People don't expect inclusion, exclusion criteria, don't expect keywords, don't expect steps. So just go and you do scoping review. You can do it quickly, but keep in mind this one is lower quality compared to the systematic review. It's a scoping review. You can do it, but you don't have to put the steps. Let's summarize the steps of systematic review. Define the research questions. First of all, for example, I need to identify organization factors in influencing medication safety in nursing homes. This is my research question. What are the organization factors, organization, not individual, but organization factors in influencing adverse drug events or medication safety in nursing home? This is my research question using SEEP's model. I was using model. Using model, maybe it's beyond the scope of this lecture, but you can use it. So it should be clear and narrow. Don't make it general. So it's not a good idea to say, I need to identify factors in influencing medication safety in nursing home, and you stop. You will find tons of data. But using SEEP's model, organization factors, make it narrower. Make your specific research question specific. Establish the team. You need to choose for scanning, screen the results, and one for the judgment of those two, to help them in the selection. I think less than 3, it's kind of not feasible. So I think 3, and you need people who are hardworking, and you need to work in team. Because people do screening, independent screening, you need to agree on the included studies, and eventually you need to write the reports. So I encourage you, so in the PhD thesis, I did it by myself, but my supervisor was there. I asked for his help, for consultation only. But I have good time by myself. The other one, flu vaccine, we were 3 people, 3 authors. We need to define the search strategies. So which search engines? Do we need to do it in the Embase, Midline, PubMed, Google Scholar, all of them? More search engines is better because will give you more robust data. So it's not, I think it's lower quality if you conduct it in one search engine. Just in PubMed, you can do it and it could be published. But keep in mind, high quality journals requested more than 2, and the ideal is 3. The ideal is 3 search engine, but doesn't mean you cannot do it in 2. Flu vaccine we conducted in 2, Google Scholar and PubMed. The ideal is 3, you can do it in 2, but 1, it seems lower quality. If you, again, I will give you example from my, I used 2 search engine, PubMed and Sinahal. So Sinahal and PubMed was available in my university website to get all the full text. I selected over the 3 decades, 30 years, which is long period. While in the flu vaccine, I selected only 6 years. So you can select the period, you can select the search engine, you can select the keywords. Keep in mind, you can do anything, but you need to justify your selection. Why did you select Middle East? Why you did select over 6 years? Why did you choose these keywords? Just justify your selection. PubMed is one of the most commonly used search engine in medical field. Google Scholar, it's very broad. So keep in mind, PubMed, it's mostly research here related to Scopus index. In Google Scholar, you will find gray, we call it gray literature, or gray area sources. That means you can find lower quality here. So keep in mind, Google will find large number of results. If you put keywords here for medication safety in nursing homes, you will find 10,000 results, for example. But in PubMed, you will find, for example, 1,000. So PubMed is narrower. Again, which kind of keywords? You need to use keywords, and you need to mention them in your thesis and in your manuscripts. Look to the keywords: drug-related side effect and adverse drug reactions, adverse drug events, adverse drug reaction, drug side effect, medication safety. All these keywords, I use them. So if you need to look for flu vaccine perception, flu vaccine barrier, flu vaccine acceptance, flu vaccine perception, flu vaccine hesitancy. So you need to choose all the related words will lead to same as your results. So for adverse drug events, I select adverse drug reaction, medication error, medication safety, as you can see, side effect. All these keywords, I tried them one after one, and I screened all the results from each one. So at the end, I included PubMed keywords, Sinahal keywords, or they call it heading. In Sinahal, I use adverse drug events and skilled nursing facility. So I usually use adverse drug events, nursing home. So because I need the adverse drug events and the nursing home. So usually for flu vaccine, I say flu vaccine, Middle East. An influenza vaccine, flu vaccine can be written influenza. An influenza vaccine, Middle East. Keep in mind, you need to justify your answers. Define exclusion and inclusion criteria. It's very important. I was looking for in the Middle East. I was looking at the 5-6 years. I was looking for primary studies. They have primary data. It's not review. It's not letter to editor. It's not commentary. I looked for studies with data. They conducted the study and they have their own data. Anyone with secondary data excluded, were excluded. So you need to put exclusion and inclusion criteria, and after that, anyone outside of your inclusion criteria, excluded. But you need to mention it. I have 6 studies, it's not in the Middle East. 16 studies, not talking about flu vaccine. 10 studies, they didn't have primary data. Each one excluded must be justified and put reason. You can look for only for male, only for geriatric, only for pediatric. It depends on your research. So you can choose the age, you can use the gender, you can use the geographical area. This is my second literature review, systematic review. I have the third one accepted, but it's not published yet. So hopefully it will be published soon. International Journal of Pharmacy Practice is one related to the Oxford, the publisher, as I mentioned. And this one, we looked for in the Middle East over the last 6 years. So limitation. Over the last 6 years, Middle East, and only data with the studies with empirical studies. Empirical studies with data, not review, not articles, not secondary data, your own data, so it can be included. So I gave you this one. You will see it again and again, but here is just example about the method. Please read the method here. You will find out. And also we dealt with people with healthcare providers and general population as well. So we looked for general population and healthcare providers. Design data collection form. I need to put the data I extracted from the literature in Excel form. I have to have Excel sheet or Google form sheet or any sheet. You need to take the information from the research you found in this extraction form. I usually do Excel sheet. I will show you the example here. Data collection form could include, I will give you example better. This is my example from my studies. This is the JAMDA example. For example, author, country, and year, main objectives, period of the study, design of the study, number of participants, outcome measure, and finally selected findings. If you put your data or your results here as this one, it's very easy to extract the information. You don't let them just, you go back and forth. Put them in table. This is my form. Then I put it as table finally. It's summarize all the 60 studies. I include the 60 studies, but I just give you an example about how I organize my findings. I put the information for each study has one line. All the information I needed. So I looked at those. Then when I discuss in the results and in the discussion, I will refer to table 2. I will say, see table 2. Because I was talking about the findings, outcome, methods. So this is one of my advice for you if you need to. You don't have to conduct literature review or systematic review for publication. It's good, it's better to have publication. But you say, I don't have time, it's not counted, I'm not sure if it's counted or not toward your 3 publication for PhD or 2 publication master. But there is debate about it. We talked about this. But at least for your own sake, for your thesis project, all the studies you found, put them in this table. It's very easy for you. You go back and read your results and findings. Okay. This is the second review about the flu vaccine. I put the title, author, country, month, objectives, study design, number of participants, and vaccination. So I added vaccination rate. You can add the columns as you want. So you don't have to stick with this one, but at least it will give you an idea about the basic requirement. It's better to register if you need to publish it. Some journals are required to register it in one of those websites. I haven't registered mine before the publication, and it's okay, they were published. Some journals, they require registration. It's better to register it, so you at least you reserve the seat. It's my idea. I register it first. If someone want to work in the same time on the same project, so at least you have a proof you register it. Registration, always good idea. It will take some time, but it's a good idea. Run the search strategy in multiple databases. As I mentioned, you need to choose at least 2 databases. The typical is the 3 databases. Collect all the references and abstract in a single file. First of all, we need to look at the title. We can exclude studies from the title. Then, those included from the title, we need to screen their abstracts. After we excluded studies, relied on the abstracts, we included the full text. You need to put the full text in one file. All the potentially included studies, put them in one file, and you need to go at least 2 of you independently, review them, scan them, and you must have agreement on the included studies. You are 2 authors, you need to screen them independently, and you need to agree on the included studies. So we screen the titles, excluded studies, irrelevant studies from the title. We had abstracts. Next step, screen those, rely on the abstracts, excluded abstract or studies. They didn't meet the inclusion criteria. Finally, we ended up with full text. You need to have the full text before you decide if you need to include it or not. So there is debate about those full text. You cannot reach them. You need to work hard to reach them, either through your university website or ResearchGate, or contact the researchers, whatever. So EndNote, it's the reference manager, will give you a good example. You can import the reference, you can import the full text. So this software is really helpful, not just reference manager, will help you to import all the references and the full text. Eliminate duplicates. I searched in 3 search engines. I eventually had duplicates, repeated articles. We have common articles published in Google Scholar, PubMed, other ones. We need to exclude them. Have at least 2 reviewers. This is the golden standard. It's better to have 2 reviewers, and you will ask me if we have disagreement. 2 reviewers, they didn't agree about this article. The 3rd reviewer must step in and help them to choose. So this is the standard. 2 reviewers and the 3rd one, if they have disagreement. Collect, compare, select for screen, full text. We have the full text. Now we need to read it carefully, read the methods, read the include. Is this article does meet the inclusion criteria? In, not, out. Put the reason why. Is because this exclusion, for example, is not in the Middle East. Doesn't have something about the perception. It's only related to the effectiveness. When we looked for the flu vaccine perception, we looked for perception, belief. We didn't care about only effectiveness. If it's only effectiveness, with no belief, no perception, we exclude it. So any exclusion must be justified. Full text, you need to have the full text. And for example, one of the inclusion criteria, full text must be in English. Because our second language is English, we are not, for example, we don't have a triple other language, so you can say any studies other than in English, we exclude it. This is good reason for exclusion. So you have 2 reviewers, you only include studies they are agreed on. They are common studies. Contact expert. If you have dilemma, if you don't agree on some inclusions, ask expert in the field. Don't hesitate to ask. It's okay. Search for additional references. Sometimes, like what I did, I looked to the references of the studies I found. So you can look to the references of the included studies. to include more studies. So it's not just only the keywords from PubMed directly. It could be indirectly. When I look to the articles, I go to their references. It's all another way. I know it's more complicated. It's not straightforward. And I'm not sure if it's required, but I don't think it's required, because in this one, you know, sometimes people look at it or not. In the flu vaccine research, we didn't look at it. In the JAMDA, I did, because I had time. Make the final selection list and draw your flow charts. How many titles I found? 10,000. How many abstract? 5,000. How many included studies? 70 studies. All the excluded studies must be, categorized. Why excluded 5,000 in the beginning? Because they are irrelevant. Why they are relevant? I put the reason. So this one called flow chart. From the beginning, title, to the abstract, exclusion, 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 end up with included studies. Component of the flow charts, you need to put the total number of the found text, abstract, excluded studies, and included studies. This is my first studies, JAMDA. I searched in Senhil and in PubMed. In PubMed, I found 395 potential relevant, 97 here. Excluded 299. Why excluded them? I put reason. Why excluded them? I put reasons. 16 studies added based on cited references, as I mentioned, from the reference. 33 studies from here, 11 studies from here, 60 studies from, I ended with 60 studies. So you need to know all the steps from the titles to the abstract after you screen and read the full text, and this is the flow chart. Prisma, my second study, second review, Prisma has better flow charts. They call it the identification, screening, eligibility, and included. We started with almost 1,000. We ended up 34. 34 studies in the flu vaccine one. Apply data collection form. As I mentioned, we need to have the form in table 2. Evaluate study quality. This one needs extensive work. First study, I did it, but for the second review, I didn't do it. And it was limitation. It's better to do it if you have time. You need to evaluate the quality of the included study. We have criteria for good quality, checklist to assess it. For example, Newcastle Ottawa scale and Cochrane one. You need to evaluate the quality. Depend on those, and each one of those, like 12 items at least. You need to go over each study. So it's better to do it. Ideally, you must do it. But if you didn't do it, it could be accepted, but as limitation. So quality of bias, risk of bias, you need to include all these assessment. We need to assess the included studies. The most famous one, or most commonly used, Newcastle Ottawa scale, and you can find it. Prepare database for analysis. This step, if you need to go for meta-analysis, now we are looking for the numbers in the studies. If you need only to do descriptive analysis, like I did, it's qualitative, descriptive. I describe the included study. I have 5 qualitative, 6 methods, 7 whatever, cohort study prospective, and I try to summarize them in the description. No need for numbers and number of patients usually. If I put number of patients, I do statistical analysis. This will be called meta-analysis, which is higher quality than systematic review only. So usually systematic review, people will assume, do we have meta-analysis or not? So we usually have title of systematic review and meta-analysis. So if you don't mention the meta-analysis, that means you only conduct the first 20 steps of this. I followed one of the research, they have 24 steps. The first one steps, they are general, common. The last 4 steps related to meta-analysis. So I haven't conducted meta-analysis yet, but hopefully I will do one in the future. I like it, but it would need more time, but it's higher quality over the systematic review only. We can do descriptive without pooling the numbers if the meta-analysis is not visible. Meta-analysis, do I need to do it or not? How can I decide to do meta-analysis? It depends on my data. And the data depends on the design of the included study. Do I have comparable design, all of them cross-sectional, most of them cohort, most of them clinical trials? When I need to pull the data, I need to have similar. I need to test the heterogeneity. Do I have similar study design? So this is the question, you need to answer it, then you decide to do meta-analysis or not. If you don't have heterogeneity, you can do it. If you have heterogeneity, you cannot do it. So it depends, and we have tests for heterogeneity, which is Cochrane chi-square test. So if we do with a heterogeneity test, if we find heterogeneity between the studies, that means they are not similar, it's hard to be conducted. But if they are similar, for example, the flu vaccine one, I regret I didn't do meta-analysis. Most studies were cross-sectional. So I could do it. I could have do it, but I didn't do it. That means if you have similar study design, you can pull the data of all patients together and do regression analysis. This is the second test for heterogeneity. And we have scale here. Exploration of heterogeneity. For meta-analysis, you need to test the heterogeneity before you go and conduct meta-analysis. Check reporting bias. So as I mentioned, you need, when you write you need to have, I think it's better to have judgment or quality assessment of the included study. If you don't have quality assessment, you may end up with low quality study in your review. That means you included low quality study. And this may affect, for example, some study, all the studies say this one is effective, and one study say it's not effective. Not because it's really not effective, because it's low quality study. They have problem in the method. So I think the reporting, after we collected all the data, now the next step, we need to start writing flowchart, checklist, intro. We should write intro, method. The method, as I mentioned here, the keywords, the engine. This is the method. The years, and you need to report the time of the working. I started in January. At the end of April, I ended my screening. So you need to mention the period of your search. If you go, for example, someone say, why didn't you include this study? They say this new study after I stopped the screening. So you need to specify the period you screened, and you need to specify the inclusion years. Why you didn't include this? Because this reason. The reviewer can pick on you and can ask you why didn't include this, and that you have inclusion, clear inclusion and exclusion criteria. Check the quality of evidence. It's better if you need to check the quality. We always have great. This article is amazing. This article, 24 steps, it's really good. Most of my lecture slides from this 24 steps of conducting systematic. It's really helpful and good sources. Update report. If you, for example, we had last systematic review ended up in August 2021. So now we are more than 6 months after August. Now we must, before we publish it, we need to do a rerun of the screening, because we may have new studies. So it depends. If your search is old, more than 6 months or 12 months, you need to do new one, because this one is outdated. You have 6 months of information on published data, you didn't screen for it. So please, if you do systematic review, do it as quick as possible. You do the search, write the report, submit it to the journal. In conclusion, healthcare professionals and researchers, you are researchers, must understand the principle of preparing such review and follow strict protocol. So it's high quality, highly cited, but it needs efforts and time. You need to have skills, efforts. It's better to do it. For example, the last review I conducted with the help of a faculty member from Armenian University, Egypt. Faculty member with master's degree. She is excited to work with me. She sent me email, if you have something we can work on. And I was her supervisor in this review. And she conducted the review in collaboration with Dr. Muhammad in our department. And we had good collaboration. So you need to have someone had experience work with you. If you are, both of you, you don't have experience, it will be hard and end up maybe is hard to be published. So at least work with your supervisor. Someone who had published systematic review before. So they know the trick, you know, all the potential questions up front. So this is so when I conducted my first systematic review, I had under the supervision of my supervisor Baldosset. He is an expert in the field. So I encourage you. This article is really helpful, 24-step guide. Just follow this guideline. And YouTube is really good source of information. Some YouTube sites in English, they are really helpful and give you an idea. The main sources I relied on, the Prisma 22 and the 24-step guide. Thank you so much for listening, and if you have any question.